Hi, I'm Katie Dottie.
I'm Kelly Effinger.
I'm Katie Howard.
I'm Julia Campbell.
And I'm Sarah Turry.
We are nurses in the state of Kentucky, and as nurses who care for ailing patients in various medical settings, we are in support of Senator Clark, Blevins, and Angel on their proposed medical cannabis bill SB 43, which is currently in the Senate. The bill states that cannabis can only be used for treating debilitating medical conditions such as cancer, HIV, and Alzheimer's, or for chronic diseases or disease treatments that cause a very specific set of symptoms such as seizures, persistent muscle spasms, or severe pain. The bill also states that a qualified medical professional or practitioner must diagnose these patients and conditions. Many studies published since the 1999 IOM have shown therapeutic value of cannabis in treating multiple debilitating medical conditions. The bill also states that the client or the client's caregiver must be at least 21 years of age. Those individuals who have been convicted of a violent felony offense or who have violated a felony-controlled substance law will not be able to obtain medical cannabis or work at any of the medical cannabis distribution centers. Medical cannabis will be grown by a registered cultivator and then go through a registered safety compliance facility to check for quality, potency, and contaminants. So as you can see, the medical cannabis bill has many strict guidelines to control the growth of cannabis, to regulate the quality of cannabis, and to restrict which people qualify for the use of medical cannabis.
In the United States, cannabis was commonly prescribed by physicians until it was criminalized in 1937 against the advice of the American Medical Association. In fact, the ban on cannabis was in the absence of scientific evidence to support it. Anti-marijuana laws from that era were meant to appease racially charged Puritans in the Southwest who associated its use with quote-unquote degenerate Mexicans and migrant workers, as well as crime and deviant behavior. Cannabis is currently listed as a Schedule I drug, indicating a high potential for abuse and a lack of medical value. However, a recent Mayo Clinic proceedings review proposes reclassification of marijuana from Schedule I to Schedule II status, similar to opioids and stimulants, which would be a first step toward reconciling federal and state laws, as well as permitting stifled research and medical care to move forward. Arguments arise that a drug of abuse has no business being used for clinical purposes. However, several Schedule I drugs have close cousins with legitimate medical applications, such as heroin and morphine, as well as ecstasy and stimulant drugs for ADHD. Cannabis contains hundreds of compounds, about 60 of them with cannabinoid properties. The best-known cannabinoids are THC, the psychoactive compound, and CBD, the major constituent of the plant, thought to act as a sedative and reduce inflammation, nausea, and convulsions. The physician can write a prescription for medical marijuana that can be higher in CBD and lower in THC to reduce the high feelings but increase anti-inflammatory properties.
It has been recently discovered that the body makes its own cannabinoid compounds, causing the same shorter-lived effects of the drug. Medical marijuana can be inhaled, eaten, or taken as a pill. Synthetic cannabinoid derivatives already exist for the treatment of various medical conditions. Extensive reports and clinical research suggest that cannabis may have many medicinal uses, including hunger stimulation for wasting syndrome, anti-nausea and anti-vomiting properties in AIDS and cancer chemotherapy, anti-spasmodic properties for multiple sclerosis, epilepsy, and other neurological dysfunctions, reducing intraocular eye pressure and glaucoma, and analgesic properties in a large number of chronic pain conditions. Chronic pain affects approximately 1 in 5 people in the developed world. Chronic pain is associated with the worst quality of life as compared with other chronic diseases, such as heart, lung, or kidney disease. Research suggests that when used in conjunction with opiates, cannabinoids can lead to a greater relief of pain, which may in turn result in a reduction in the use and abuse of opiates. In a study to determine the effects of smoked cannabis on pain associated with HIV, neuropathy, and pain, researchers found that smoked cannabis was well tolerated and effectively relieved chronic neuropathic pain.
Recently, we encountered a patient who has had success with medical marijuana use. Mary is a 53-year-old female who was diagnosed with multiple sclerosis in 1998. Since 2010, Mary's arms and legs have become progressively weaker, and in 2011, Mary began experiencing painful spasticity attacks at night. Mary has paresis in her legs, is unable to walk because of flexor spasticity. At first, Mary was taking baclofen and Lyrica for treatment with no relief. Next, intravenous and intrathecal steroids were administered and also provided no relief to the patient. THC CBD oral mucosal spray was then added to the patient's treatment. Upon starting the treatment, Mary was taking 3 sprays in the morning and 5 sprays at night. Soon after the initiation of therapy, the patient was able to transfer with assistance. Now, after 611 days of treatment, Mary is using 3 sprays of THC CBD spray at night along with baclofen and Lyrica and is able to walk 4 meters in 2 minutes as well as transfer without assistance.
So far, 20 states and Washington, D.C. have approved of marijuana in some form, with Colorado and Washington State being the only states to approve recreational use. The financial benefits of legalization of marijuana are currently being researched. According to Denver's 9 News, when the first 37 recreational marijuana dispensaries opened on January 1st in 2014, sales totaled to over $1 million and reached $5 million in the first week. According to the Colorado Department of Revenue, Division of Taxation, $70 million in tax revenue is expected from marijuana sales this year, with the first $40 million to be spent on education in schools and the rest to be spent on marijuana regulation. Instead of the increase in charges and prosecutions for possession, there has been a decrease. The Colorado Judicial Branch shows a 73% decline in possession charges and a 17% drop in charges for public consumption. One Harvard study has predicted that $8.7 billion a year will be saved in law enforcement and courts dealing with drug offenses. In conclusion, passing the Cannabis Compassion Act will be beneficial to undertreated patients and to the financial state of Kentucky. We thank you so much for your time today.